So what I wanted to cover today, how this is going to work is I'll talk for about 30 minutes and then have about 10 minutes for questions, and then we'll switch over to Lindsey. But what I hope to cover in a brief 30 minutes is how cancer and its treatment impacts nutritional needs and nutritional status. Then how does an individual's nutritional status impact clinical outcomes, and really expressing how important it is for nutrition and good nutritional status during treatment. And there's a lot of challenges to eat well during treatment. So some practical tips and strategies to eat well during cancer, and then kind of summarize some main points and takeaways. So first, how does cancer and treatment impact nutritional needs and the nutritional status of a patient? It's first important to understand that our body requires energy, right? And that's what this is showing. This is our cellular form of energy, and we get that from food. So carbohydrates, protein, and fat are providing the energy that the body needs to build, maintain, and repair. But what we see during cancer is that there's increased energy needs. Those cancer cells are also requiring energy. So there's increased energy needs, which creates a competition between the tumor and the host. So if there's not enough nutrition coming in from the diet, the body has to tap into energy stores, including fat cells, but also ends up tapping into muscle. And really, we don't have muscle or protein storage in our body. So when we're sacrificing muscle, we're really sacrificing a lot of physical function and maintenance of the muscle. What we see is increased protein breakdown and increased metabolism of fat. That's why one of the early signs of cancer is unintentional weight loss. So someone might be eating the same, but seeing weight loss because of those increased energy needs required by those cancer cells, and for the body itself trying to attack the cancer cells. And then cancer treatments add another level of complication to this. There's many different cancer treatments, but I'm just going to summarize some of the big ones here, is that surgery is done to remove cancer cells and the tumor, and that increases energy demands on the body to heal and recover from these big surgeries. Radiation is intended to damage DNA, to kill cells, or to slow growth, but that can also damage the normal healthy cells around that. Chemotherapy is that systemic option for treatment, and so that is targeting cells that are rapidly growing and dividing, and it's not just cancer cells that are rapidly growing and dividing, right? Cells of the GI tract, hair, skin, nails, those also get damaged from chemotherapy. Immunotherapy is a newer treatment out there, and that's helping the immune system act against cancer cells. So then there's also increased energy demands from those immune cells that are trying to damage those cancer cells. And so in sum, these treatments can damage normal healthy cells, which makes it important to get enough nutrition to repair those damaged normal healthy cells. But then there's a lot of factors that can impact the body's ability to get nutrition in and to absorb the nutrients that are being consumed. So a lot of these treatments have many side effects like nausea, vomiting, difficulty swallowing, mouth sores, which can make it difficult for an individual to eat. Then there's also impairments on the ability to assimilate those nutrients being consumed. So if there's vomiting, or if there's malabsorption, which is something pretty common in pancreatic cancers or GI cancers, that these nutrients are being more poorly absorbed. And I gotta move this little box here, diarrhea as well. So these are all things that can impair the body's ability to get nutrition in and to absorb those nutrients coming in. So these nutritional implications of cancer is that there can be mechanical barriers making it difficult to eat. If there's a tumor in the GI tract, physiologic barriers, as I talked about, those side effects that make it difficult to eat and painful to eat, or reduced absorption. And then there's increased nutrient needs for healthy recovery from these cancer treatments. So altogether, this creates an imbalance. That there's increased nutrient needs of the body to go through cancer treatment, but there are factors that are reducing the intake through these side effects or impaired nutrient absorption. So this increases an individual's risk for malnutrition. And the incidence of malnutrition, it's estimated that up to 80% of individuals going through cancer treatment will develop malnutrition sometime during that period. And it's not just the cancers that you would assume you'd see malnutrition, like the pancreatic cancer and gastric cancer. Of course, the cancers of the GI tract, we're seeing higher incidence of malnutrition. The things that have nothing to do with the GI tract, we still see incidence of malnutrition, including prostate and breast cancer. So we're concerned about this, which I'm going to go into about why is that important, this malnutrition that develops during cancer. And also to point out that most people associate malnutrition with someone who's really thin, frail, but we can't look at somebody and determine if they have malnutrition. Body weight is not the whole picture. Of individuals that have malnutrition, less than 7% of them have that obvious malnutrition, that really low BMI frailty. 40 to 60% of those with malnutrition are overweight or obese. So again, BMI does not matter, weight does not matter. It's not going to tell us the whole picture of an individual's nutritional status. And I put this picture here because I think a picture says 1,000 words, but this is showing different BMIs. So someone who is underweight, this would be the overweight versus obese category. And what you see in red here is the muscle. You see stark differences in muscle mass. So this individual with a low BMI still has more muscle than this individual here, categorized in the obese category. So again, BMI is not telling us the whole picture. And what we're really concerned about is this loss of muscle mass. Because poor nutritional status is going to slow the body's ability to heal and recover. For all of these new cells to be regenerated, every single cell in our body is made up of the nutrients that we get from our diet. So if we're not getting enough nutrition coming in, that's going to slow the body's ability to make up these new cells, healthy cells, to heal and recovery. So it can impair wound healing post-surgery, or a recovery from those radiation burns during treatment as well. It can impair immune function. So if immune function is impaired, that can delay administration of chemotherapy and cause either dose reductions or treatment delays, because we always want to see those white blood cells recover, those neutrophils recover before someone would be able to start another round of treatment, another cycle. So it can delay chemotherapy, and it can also increase the risk of infection. And then because every single cell in the body needs good nutrition, poor nutritional status can interfere with the proper functioning of our key organs and physiological systems in the body, including the heart, liver, and kidneys. So this malnutrition is clinically significant. We have seen in the literature, in the research, that malnutrition during cancer can reduce treatment response. So we see poor treatment response in individuals with malnutrition, which could be related to more frequent treatment interruptions. So there's delays in treatment, they're not able to get the original dose of treatment, and so not able to get the benefits of the treatment. Also see increased risk of infection and hospitalization. I'm always really concerned about that quality of life piece, that there's decreased quality of life in malnutrition, and then that increased risk of mortality and death. And frankly, there should be more attention paid to malnutrition during cancer treatment, because it has been estimated that malnutrition itself is the direct cause of 20 to 30% of cancer deaths. So our goal is to prevent malnutrition and help an individual maintain good nutritional status so that they can stay on treatment, reduce their risk of infection, improve their quality of life, and get the most out of their prescribed treatments. So there's this dynamic relationship that cancer and treatment-related side effects can reduce nutritional status, and then reduced nutritional status can impact cancer and treatment-related side effects and can also impact treatment outcomes. So it is important in cancer care, and that's why you're all here, but just again to highlight where this relationship of nutrition really comes in. So I set up the part about how important it is, but I also set up how difficult it can be to eat well during cancer treatments. I want to give some actual practical tips on if malnutrition is so important, then how can I maintain good nutritional status during treatment? So these benefits of maintaining good nutritional status, what I underlined there is that it can reduce the risk of reductions or interruptions of cancer treatments. These cancer treatments of the chemotherapy, immunotherapy, radiation, we know can result in better outcomes and clinical outcomes in our patients. So we want to use nutrition to help patients adhere to these known treatments that can benefit outcomes. Then, of course, we want to preserve that skeletal muscle mass and physical performance so that individuals can have good quality of life, maybe continue to work or be with their families, is we need to keep that muscle mass strong and maintaining that strength and energy. I'll get into a little bit today about fatigue, but also protecting immune function to reduce the risk of infection, promoting recovery and healing, and really maximizing quality of life. So what are some nutrients of concern that really want to target and focus on during cancer treatment is protein, getting enough energy, some micronutrients, which I'll address a little more, and fluids. So I'll go into each of these a little bit more. First recommendation is about protein, that there are increased protein needs during cancer treatment. The recommendation for general healthy adults is 0.8 grams of protein per kilogram of body weight. For cancer patients undergoing treatment, 1 to 1.5 grams per kilogram of body weight per day. So the minimum is 1. In some later stage advanced cancers, we might go up all the way to 2 grams per kilogram body weight. So almost doubling needs of a general healthy adult. And that's because of this increased needs for recovery and healing, immune function, all of that has really high protein needs. And a variety of animal and plant-based protein sources. You don't have to eat animal products if you don't want to. You can get protein from plant-based products and really try to emphasize that getting good quality proteins in the diet. And a strategy I recommend to patients is to aim for protein at every meal and snack, even if it's just a few bites of some protein. It's important to try to sneak that in wherever possible because this 1 to 1.5 grams of protein might be more than what you were eating before treatment. So really have to be very proactive about getting enough protein in the diet. Because if you don't get enough protein coming from food, the body's got to get that from muscle. And as I mentioned earlier, we want to preserve that skeletal muscle mass. As far as our recommendations for micronutrients, we want to meet the recommended intakes. More is not necessarily needed unless there's a deficiency identified, but commonly we might see during treatment an iron deficiency, anemia, or we might see osteopenia and osteoporosis, so might need some increased calcium and vitamin D. One thing I generally recommend for some of our patients is to get vitamin D status assessed so we can get them back up to optimal levels before starting treatment. But generally, we're not recommending more unless there's a deficiency. and high dose micronutrients are discouraged, which I'll address a little further because of their potential interactions with treatment. The recommendations across multiple organizations is that a general multivitamin is recommended during treatment, as it can help fill in the gaps when diet quality might be reduced. And then hydration. We can't talk enough about fluids and how important it is to maintain good hydration and getting in adequate fluids. What is here on the right is showing the different colors of urine, and you want to be about the 1 to 2. So a good way to assess nutritional status is to just look in the toilet and see the color of the urine. Anything 3 or higher, that darker yellow, indicates dehydration. I recommend for patients to weigh themselves daily or at least weekly to monitor some weight fluctuations. Anything that's a drop of 2 or 3 pounds in a day is likely more related to fluids than it's going to be related to fat loss. If there's any vomiting, diarrhea, or fever, fluid needs increase even more. And do not wait until thirsty. We know that during illness, that thirst signal is impaired. And so you might not feel thirsty, but your body is actually dehydrated. So don't wait until you're thirsty. Try to maintain good hydration throughout the day. Also, to be focusing on replenishing some electrolytes, especially with vomiting or diarrhea. So getting an adequate sodium or potassium, because those fluid losses, you are also losing these electrolytes. So there are some options, electrolyte replenishment options that I recommend, that they should contain multiple electrolytes. So not just sodium, but you're also losing sodium, chloride, calcium, potassium, magnesium. There are lots of oral rehydration products out there, and just making sure that they have these multiple electrolytes. And sometimes I recommend them because some people don't like the taste of water, and some of these electrolyte beverages can help with the palatability of a fluid, and can also be helpful because they're just increasing fluid intake. So like the best one is the one that you're actually going to drink and like. Because I have tried a variety, because I've tried to recommend some to patients, and some are kind of gross. So, just because you didn't like one, try another brand. Okay. But also to mitigate unintended weight loss. Another reason why I recommend people monitor those weight fluctuations is not just for monitoring fluid status, but to address weight loss right away, and to really be proactive in addressing even small changes in body weight. We know that as little as 5% weight loss has been associated with poorer survival. So there's going to be a need to increase calories. So frequent small meals, choosing more high calorie, high protein foods. Oral nutrition supplements can be helpful in getting a lot of calories, a little more bang for your buck. And then if there are side effects that are impairing your ability to eat, like appetite, nausea, diarrhea, that these are things that you need to share with your provider, because there are strategies to help mitigate some of those side effects so that you can eat better. So don't really have to tough them out. There are some ways to help mitigate and reduce some of these side effects that can impair the ability to eat. We need to address that early, because there are lots of side effects that can impair the ability to eat well. Loss of appetite is very common. I also see people reporting changes in taste or smell. So things might taste metallic or off, sour or extra sweet. And so there are lots of things that can get in the way of the ability to eat well. Some of them, there are strategies to, maybe a medication strategy to help with. And some of them are just, we can come up with some foods that you should avoid so that you don't exacerbate that side effect and make it worse. So for example, mucositis is that mouth sores, that painful mouth redness. Well, don't eat foods that are acidic, pickled, or spicy. So citrus, those types of things should be avoided because that's going to burn and be very painful. This would be a time to choose more moist and soft foods so that you're not crunchy foods, hard foods can kind of also tear up sides of the mouth. Serving foods at cool or room temperature could be easier to tolerate. Carbonated beverages, those bubbles can also cause some pain. So we can't fix the mucositis, but we can try to avoid foods that are going to be painful or make it more difficult to eat. Taste changes is another one. Some taste changes could be caused by zinc deficiency, so it might recommend a zinc supplement, a certain amount. But if things taste metallic, then don't use metal silverware. Choose plastic silverware, or I recommend doing a mouth rinse or brushing teeth before eating to help get rid of some of that off taste in the mouth. I can't go over every single side effect, but just to know if you have some of these side effects, that there are strategies that you can use to try to still eat well when you have these side effects. And there are lots of resources that I'd be happy to refer you to that address many of the side effects that happen during cancer treatment. But one of the most common ones is fatigue. And that fatigue makes it really difficult for people to eat well. And so I did want to spend a little more time on this particular topic and some strategies for eating well when there's limited time in between appointments and going to work and taking care of your family, and your energy levels are down. This can be a time to temporarily rely on ready-to-eat foods, that you don't have to cook everything from scratch. For example, like HEB has this whole selection of these prepared meals that you just need to put in the oven. And it's okay to utilize these types of foods so that there's less preparation time and you're spending more time on the recovery piece of what you're going through during treatment. This has increased a lot now during COVID, but more meal delivery, grocery shopping services. It's already a good idea to avoid some of these large public places because of the reduced immune function patients have. So utilizing these services that can bring that food to you. And often I hear that family members or friends are reaching out to patients saying, let me know how I can help. And this can be a way that people can help, and it's a concrete strategy that they can help. You can ask them to go pick up your grocery delivery for you. Could you chop up some of this fruit or wash this produce for me? That there's some concrete ways that people that want to help can help, and they can help you with your nutrition. Also, convenience can be worth the cost. Frozen foods or some fresh steamable bags, those things might be a little more expensive, like the things that are already in the bags and washed and portioned out, but that's also saving you some time, and your time is money. Or choose fruits and vegetables that require no or limited prep, and I'll show a couple of examples. When energy levels are better, that would be a good time to help prepare food when you feel your best and portion them out, put them in the freezer, or have some of the cut up produce already in the fridge so that you're making the most of the time when you do feel well, so that you're prepared for the times that your fatigue is a little worse. And fluids. Definitely focus on getting some fluids as well, that dehydration can exacerbate fatigue. So this is what I talk about with some produce that requires less prep time, that they really are just a rinse away. So sliced mushrooms, sugar snap peas, baby carrots, these are baby sweet peppers or cherry tomatoes, berries. These are all things that just require a rinse. No chopping for any of these fruits like pears, plums, peaches. But these are also ways to get in some fruits and vegetables that don't require a lot of prepared time. You don't even have to cook any of these. And to rethink meal. Things might look a little different when your appetite is so limited, or your fatigue is so bad that it could be challenging to try to sit down to a full meal like you did in the past. So a meal can just be a more substantial snack. Like this picture here, this serving of nuts is about 200 calories right there. Smoothies, trail mix, hard-boiled eggs, crackers, cheese and meat, peanut butter and jelly, a grilled cheese sandwich, a big bowl of whole grain cereal, something like that, can count as a meal. So it doesn't have to be your 3-course meal or even a plate with the fruits and veggies and protein. Like that's great if you can do that, but to also, these count, and these are also ways that you can get in good nutrition when you have limited time and limited energy and limited appetite. And to kind of address this too is when there is limited appetite, I would love for patients to eat tons of fruits and vegetables, but when there's only so much room in that stomach and the appetite is already low and early satiety, so feeling full earlier, they might fill up on a couple of cups of broccoli that provided maybe 60 calories, but didn't give that individual the calories and that energy that they need. So we call these nutrient-dense foods. So this would be like our fruits and our vegetables. Calorie-dense are things like pizza and burgers and fries. So with not a lot of food, we get a lot of calories. And what we want to focus on during treatment is to find foods that are both calorie and nutrient dense as a strategy to get the most bang for your buck in that bite. So you don't have to resort to pizza and burgers to get the calories you need. There are also nutrient dense foods that are also calorie dense. So some strategies I've recommended to individuals are trying things like avocados and blending them in smoothies or adding them into meals. Chia and flax seeds, nuts and nut butters are really calorically dense. Smoothies, beverages, drinks, and even being a little liberal with some healthy oils like olive oil or avocado oil, adding them to soups or pastas, just to get some more calories in as well. And so what we really want to focus on during treatment is, of course, this foods first approach. I'd love for people to meet their nutritional needs from whole foods that provide calories, but also protein and vitamins and minerals. But this can be really challenging at times to meet all nutritional needs from just food. So there is a time and place for oral nutrition supplements. A lot of people don't like the taste of Ensure or Boost, but those can be strategies for people, or I help people develop their own kind of version of those products that they like, because it can be challenging to only get it from food. And then also showing that in cancer care, there becomes a time and a place for some patients to rely on like tube feedings or nutrition coming in through the veins. So there's no shame in that. This is all strategies that we can try to utilize to ensure that our patients maintain good nutritional status. And then that leads into dietary supplementation. When is that appropriate to utilize, and how can we use that safely in cancer care? So there is a time and place for supplementation. I mentioned this a little bit earlier about, for example, if someone has osteoporosis or they've got an iron deficiency anemia or B12 related anemia, we need to supplement with that specific vitamin or mineral that's resulting in this condition or deficiency. During unintended weight loss, so if someone's not getting enough nutrition coming in, that's where that general multivitamin can be helpful. For example, patients that have a gastrectomy or an ileostomy, they're going to require a B12 supplement. Before surgery, some immunonutrition oral nutrition supplements have been demonstrated to promote better healing and recovery post-treatment. Or for managing symptoms, for example, ginger for nausea and vomiting, Some neuropathy might be related to B12 deficiency, so that might be helpful. So what I'm trying to show here is that we need to be targeted. Like, what are you taking this supplement for? What is it intended to do? Rather than just taking a whole bunch of different herbs because you heard this might be good or it might help with this, is we need to have a very targeted approach, and that we are taking it knowing that it will have a particular outcome. But we also want to make sure that it is safe. Okay, there are some supplements that can interfere with the efficacy of treatment. Okay, so we really want to make sure that patients are reviewing all of these with their healthcare team. And make sure that you've also worked with a dietitian so that you've had that food first approach. And then if you're having a hard time meeting nutrients with foods, then a supplement. Also knowing that dietary supplements in the US are not regulated as far as safety and purity. So a supplement does not have to go through testing to make sure that it's safe or pure to go out on the market. There are these third-party certifications that you might see on a product, and what that indicates is that the company has paid for these third-party companies to test their products to make sure that they have what they say they have. So if you are going to choose a dietary supplement, to make sure that you're getting it from a reputable brand. Okay. To put it all together, really focusing on the foundation piece. The foundation piece is that the body needs enough energy for healing and recovery. Okay, we're focused on getting in enough energy, and then that energy is coming from carbs, protein, and fat. And as I mentioned earlier, needing a little more of that protein during this time. Then focusing on meeting these nutrient needs with a variety of healthful foods. And then the role of supplements can be helpful in a more targeted approach. And too often I see people asking about this, the supplement piece, and which supplement should I take, without addressing any of this part. And this is really where we know it's going to have the most benefit in our patients, is if we can maintain good nutritional status with adequate calories, protein, nutrient-dense foods. That is going to have much more of an impact than a turmeric supplement or a glutathione supplement. So focusing on the foundations. So now that I've really nailed down how important nutrition is, I understand too that there's limitations likely in your care, that nutrition resources are limited in cancer care. This is a recent survey that came out late last year where they surveyed cancer centers in the United States. The ratio of dietitians to cancer patients was 1 to every 2,300. There's no way. So most patients are never going to interact with a dietitian during their care. And unfortunately, that's where it becomes a little more of the responsibility of the patient right now, if they're not getting those services from their treatment center, is to seek an expert and to seek a registered dietitian. And I put these in here because these are stock photos. If you Google like registered dietitian, this is what comes up, which is ridiculous. This is not what we do. I have never done this in my life. And unfortunately, people think like we're the vegetable pushers and asking about weight and making people eat kale. That is not the role during cancer treatment. We are the experts that have that medical nutrition therapy training that's going to consider the whole person, and not just what's happening now, but other comorbidities, other health issues. Help prepare the patient for treatment, provide tailored recommendations for that individual, understanding the barriers of that individual, help them manage side effects, and really have a more food first and focused approach. So that's how we are different than general nutritionists or things like that. To summarize here, cancer and cancer treatment increases nutritional needs, right? And that puts the patient at risk for malnutrition. And that poor nutritional status impacts health outcomes as well as clinical outcomes of survival. being proactive, not reactive in managing nutrition. So don't wait until there's 20 pounds lost to try to address it. As soon as it's difficult to eat and there's unintentional weight loss, we need a strategy and an approach to address that. Really keep it simple. Focus on the foundation piece, getting enough calories, try to get a variety of healthful foods, and don't get so wrapped up in individual foods that you need to include or avoid or supplements. That really focus on that foundation. Seek a registered dietitian with oncology experience if you don't have one available in your treatment center. And I love nutrition, but nutrition is a powerful tool, but it is not the only tool. Nutrition is part of this integrative approach to oncology care. And so it's integrated within the model. It is not something that should be looked at as an alternative to cancer treatment. What we know is that good nutrition can help support what we're doing with radiations, immunotherapy, chemotherapy, etc. Okay, so I've cut into my time for questions, but I do have about 5 minutes for questions. Also, I am on social media, on Instagram and Facebook, where I post other information related to this as well.
Thank you, Krystle. So we've gotten quite a good amount of questions. Some of them I'm going to leave until the end because I know that Lindsey will be focusing on some of the topics such as soy, alcohol, and more about plant-based diet. So we're going to hold off on those, but there are a few here that I would like to ask on behalf of the audience. The first is, it's been said that avoiding fresh raw fruit and veggies due to bacteria that may remain after washing may be something they need to consider. So what are your thoughts about that and the fact that they need a lot of fresh fruits and vegetables in their diet?
Mm-hmm. So there was like a concern, it used to be called the neutropenic diet. And so they would recommend people avoiding raw fruits and vegetables, raw fish. There's actually been some newer evidence showing that these neutropenic diets are too restrictive and that they actually don't reduce the risk of infection. But with that said, I know a lot of people are concerned now with COVID that there are hands on your produce, and you can still get the same nutritional benefit from frozen vegetables as well. Or you could choose fruits that have a thicker rind that you're actually gonna get rid of, right? So for example, melons, right now you're gonna be cutting off some of the sections that people would be touching. So again, if you are concerned, I would say choose the frozen options or choose some of these fruits or vegetables where you're actually removing some of that portion where there might be more bacteria on there.
Wonderful. How about, are there any foods that specifically help with white blood cell count, neutrophil count, or dealing with anemia?
Great. Protein, but it's like there's not one specific vitamin or nutrient. You know, with all this fears again about COVID, we were seeing all these supplement sales increase for things like vitamin C or zinc. Our immune system is much more complicated than just because we're lacking one specific vitamin. That our immune cells require that we have enough energy, that we've got adequate protein, as well as a variety of vitamins and minerals involved. So again, to have good immune function, we need to look at that base again, that foundational piece of energy, protein, variety of healthful foods.
How does a physician or a doctor determine that a patient is malnourished?
That's a great question. Unfortunately, another thing that came out of that survey was that only a little over half of those cancer centers were screening for malnutrition. So it is not well measured in cancer care. And part of it might be related to, they know if they screen for it and a patient has malnutrition, then they need to do something about it. It might not have the best resource to direct them to. So unfortunately, there are tools available and there are validated tools available that physicians could use to screen for it, but it needs to be implemented into their actual care.
Are there any specific recommendations for people dealing with bladder cancer treatment? Anything specific to that population nutritionally that hasn't been spoken about yet in the presentation?
You know, that is, and also that's one that I'm not as familiar with, so I really couldn't speak to specific recommendations for that.
Okay. And then the last one, until we get to our second part of the seminar, and again, we will cover another Q&A at the end, but is kombucha okay to drink during chemotherapy, or are there concerns with that?
Okay. The thing with kombucha, one of them is that most kombucha is going to have some trace amounts of alcohol. So you should well, you don't necessarily have to be concerned, but are there issues with liver function or kidney function? Then probably don't want to be introducing anything that has any alcohol. You're also introducing some bacteria. So there's might be some concerns about if your immune function is impaired, do we want to introduce even more bacteria into the body? But generally, it's safe. It's generally safe. On that neutropenic diet that we might have individuals undergoing a bone marrow transplant, that would be a no. The kombucha would definitely be a no.
All right, thank you so much, Krystle. And Krystle will be around at the end to answer further questions. And we are going to move forwards with Lindsey next, talking about survivorship.
Hello, let me just share my screen. Ooh. Can everyone see? Okay, great. First, I just wanted to say thank you to Krystle. That was such a fantastic presentation and really leads in well to what I'm going to be talking about next, or transitioning us into, which is thinking about after treatment and what are some of the long-term goals that we want to have for survivorship. And so kind of leading into that, you know, in January of 2019, we had estimated just under 17 million individuals who were cancer survivors. And that represents about 5% of our population. And I mention that just because cancer touches so many different lives. And before we kind of get into some of the specifics, one of the things that I just want to say to that is that, you know, each individual is unique on their cancer journey. Everyone is going to have their own personalized dietary needs. And so there really is no one size fits all approach. I think Krystle really highlighted that well, that you know, everyone's in a different place in terms of where they are in survivorship. And that's where there really can be benefit to working with a registered dietitian who can put together a more individualized plan for you. But my goal with what we're talking about today is just some of the broader actions that you can take to help reduce risk for the long term. Let me just move my... So when we talk about survivorship goals, one of the things that if there's anything that you walk away from this presentation with, I hope it's that you feel that how important it is to have a healthy eating pattern over your lifespan. So it's not about any one particular ingredient in your diet. It is, what's the overall composition like? And do we have a healthy eating pattern that we're following the majority of the time? And what I mean by a healthy eating pattern, where we see the greatest benefit for survivorship, is with a more plant-focused diet. So that doesn't mean not having any meat at all. There's certainly room for some animal protein in a healthy diet, but that we're shifting more towards what Krystle was talking about, which is that we want to get to more nutrient-dense foods. So that the goal ultimately is that when we're having more nutrient-dense foods, it means they don't have as many calories to them, but they have a whole lot of nutrition that is helpful, and where we see the biggest benefit towards prevention and reduction in recurrence. In a healthy eating pattern, we're also limiting our intake of red meats and processed meats, which we're going to talk about more as we go along, as well as things like sugar-sweetened beverages or added sugars and highly processed foods, and then avoiding alcohol and tobacco as much as we can. And so another goal that we have is maintaining a healthy weight. We know that our instance of chronic disease risk is linearly connected to our BMI. So the more weight that we have, the more our risk goes up for chronic disease. This is also related to what we see with cancer recurrence and survivorship, is the more weight an individual carries, the more likely they are to have poorer outcomes. And then the importance of engaging in regular physical activity. Where we see the greatest effect is when we have this synergistic element or impact from not only considering a healthy eating pattern, but incorporating physical activity as well. And then, you know, we're inundated so much with media that is, you know, trying to confuse, or oftentimes ends up confusing us with respect to, is there a special diet that I should follow, or is there a certain supplement that I should take? And, you know, my goal with us going through this is to see that there really isn't a magic diet with respect to cancer and chronic disease. It's more this healthy eating pattern that we want to move towards. And that kind of leads into this simple truth. You know, where do we really see time and time again the most significant impact on our health? And where we see that is with eating our fruits and vegetables, you know, doing what our mom told us to do when we were kids. But there really is so much science behind this, that when we incorporate more plants into our diet, which are not just our fruits and vegetables, right, but our legumes and our beans, whole grains as well, nuts and seeds, any of our plants, that's where we see the greatest impact on decreased risk. Why do we see that? Well, we have important components in our plant foods that I'm going to go into in more detail, but our vitamins and minerals, phytochemicals in particular, and fiber help to, again, give us all this nutrition without all of these calories. And they also help us to feel more full throughout the day, so we get more from them as a result. When we have a more plant-based diet, often naturally we end up having a diet that's lower in our animal fats, added sugars, and processed foods, which we see direct correlations to direct impact in increased risk. So again, that goal is that healthy diet pattern overall. What's your total composition like? And do you have variety? Variety is really important when we think about having more plants in our life. So what do I mean? What should this look like? Well, our dietary guidelines for Americans have this visual, and I always like a picture. Like Krystle said, it's worth 1,000 words. But my plate is a representation of our dietary guidelines for Americans. And it's moving towards this idea of more plants in our diet. So instead of having a plate that, you know, if we're in Texas, right, is maybe barbecue with lots of more high-fat foods, instead we're moving to this idea of half of our plate is being comprised of fruits and vegetables. Then we have another quarter to third of that plate is from whole grains. So 2/3 of our plate's coming from plants. And then we have that smaller section reserved for our protein foods. And ideally those would be lean proteins. So things like chicken or poultry, turkey or fish and things of that nature. So how do we work towards this? Well, our aim is to be somewhere around 3 cups a day for vegetables and 2 cups a day for fruit. And so if you're looking at that composition of your plate, you know, you might opt for something like, I have a, you know, small piece of salmon, and then I've got a whole grain, something like my brown rice or quinoa, and then a variety of vegetables. You might have some broccoli and some bell pepper, something like that. And then maybe you have that orange or apple that is for after your dinner meal as something that helps to quench that sweet tooth. That's the ultimate goal of what we want our plate to look like. Another concept within this too that's really important for survivorship is also staying hydrated. As Krystle mentioned, fatigue is very common in the cancer community, whether you're undergoing treatment and often after treatment too. And if we don't stay hydrated, we're 60% water. So we really need to be replenishing any losses that we have. But we also want to make sure our body is able to work as optimally as it can, and we need hydration to be able to do that. One of the first signs that we'll see of being dehydrated is fatigue. So you don't want to add to that by simply not staying hydrated. So there are a lot of different tactics to how you can get at this. But, drinking your regular flat water, but a lot of people enjoy things like sparkling water or non-sweetened flavored waters, things like LaCroix or Waterloo or Big Swig or something like that. But you also could get some of your fluid intake as well from things like coffee or tea. The most important thing to think of with those, though, is not adding a whole bunch of cream or a whole bunch of sugar to them, but they can help to provide some of that hydration as well. Thinking about color is so important when we consider what a healthy diet is going to look like. One of the benefits of having more color is that it provides phytochemicals. So phytochemicals, what these are, is they are naturally occurring plant chemicals. So there are thousands of phytochemicals in our foods, and many of them help to dictate the color of the fruit or vegetable that we're consuming. So the more color that you have when you're building your meal, or, over time that you're incorporating more color, the more of these phytonutrients you are going to get. And the benefit of having these phytonutrients that exist in our plant foods is that they are very powerful compounds. They do lots of different things in the body to help reduce risk, including helping to inactivate carcinogens, which carcinogens are compounds that can produce cancer cells. We also see an impact on being able to even stimulate certain cancer cells to die. They support the immune system and the function of the immune system to help with, mitigating any potential interaction that we could have that is promoting cancer. And they reduce inflammation, which is implicated in a lot of our different cancer progression. So I would encourage you to look at this list and just think about where maybe you could incorporate more of these plant foods. Maybe it's that there's a whole color that you can't even remember the last time you had a blue or purple colored vegetable or fruit. So then maybe that's something that you would focus on. Or maybe you feel like you're eating from all of these different groups, but there are just some that you've never tried. Maybe you've never had a golden beet before. But try to focus on one or two things that you might be able to add in to what you're currently eating to increase that colorful plate and add more of those phytonutrients into your life. The idea, though, and one thing that I want to show with this table is that phytochemicals do a lot of different things in the body, and they have synergistic effects, meaning they work together to help make an impact on cancer progression and recurrence and overall just a healthy diet that's lowering chronic disease risk. And so it isn't about one singular phytochemical. And sometimes we hear about things in the news or media of this one particular phytonutrient being, the cure-all. And it really is more about the whole picture, continuing to have that variety in your diet and in your lifestyle so that you're getting all those synergistic effects of these phytonutrients and how they work together to improve health. Another way to think about how you could start incorporating more plant foods beyond just incorporating more color into your diet is just thinking of some helpful hacks. So one of my favorite things to do personally when I'm trying to get in more plant foods, and maybe you feel like you're doing this already, but so many of the population, these basics are where a lot of their nutrition is lacking. And so trying to get more creative with this, especially right now, with so many of us being at home a lot more and cooking a lot more because of that, there's a real opportunity, a positive that can come out of this stressful and challenging time, is that it could prompt more creativity in the kitchen, trying new recipes or playing around with how you can get more vegetables and plants into your diet. One of my favorite things to do is blend my vegetables into things like sauces or adding them to soups or stews. It can be a really nice trick where you aren't even really noticing that they're there, but you're enhancing the nutrient content of that meal. Power packing your casseroles or meatloafs, some of your favorite recipes with more vegetables, can be a really helpful tool as well. I'm also a big fan of starting early. My husband, every morning like clockwork, he gets up and he has oatmeal with some fruit on it. And that's just part of his daily routine. And that's something that, again, starting early helps to be able to get more of those fruits and vegetables in there that we really want for health. And then even trying things like new cooking techniques. So often I hear of clients that I work with, they primarily steam their vegetables, or they have kind of one way that they prepare things. And there are so many more creative ways that you can cook and prepare vegetables where they have just added flavor. Roasting is one of my favorite ways to get more flavor in your foods. If you've never had a roasted carrot, I challenge you to try a roasted carrot or roasted broccoli. And then playing with herbs and spices too can be a really great way to add more flavor to these plant foods and increase your capacity for them in your diet. While we're talking about all these wonderful foods that we want to incorporate more of, there are also some that we want to be more careful of in survivorship. And so one of the ones that I get asked about a lot is red meat and processed meat. And when I'm talking about red meat, what I mean are meats like beef, lamb, pork, goat, things of that nature that are darker meats. And if I'm talking about processed meat, I'm talking about meat that has been cured or salted, or it is has been processed in some way that alters some of its composition, typically adding a lot more salt or more fat to the preparation. So that's going to be things like hot dogs or bacon, our deli meats, sausages, things of that nature. And what we see is that when we have higher intake of these red meats and processed meats, that when they are cooked or when they go through that curing process, there are compounds that are formed on those meats that can be carcinogenic in the body. And so as a result of that, we see increased risk for colorectal cancer, but we've also seen in more recent research that there is increased risk for even esophageal cancer, breast cancer, prostate cancer. So if you are going to consume red meat, there are some benefits to non-processed red meat. It is a nice source of protein, high in B vitamins and iron and zinc. And so because of that, if you want to incorporate red meat into your diet, the important part is limiting your consumption. So current guidelines recommend 12 to 18 ounces per week is your max. So think about that as like, a 4-ounce portion, like three times out of the week. But because of processed meats not providing a whole lot of helpful nutrition to us, and again, being high in things like saturated fat, often in sodium that can increase our risk for cardiovascular disease and hypertension as well, the recommendation is to avoid those altogether. So with these types of foods, if they're predominant in your diet, trying to incorporate more things like fish or seafood, poultry, and plant-based proteins, so things like tofu or soy, also putting in legumes or beans and lentils can be really great options to move away from so much of our red meats in our diet. Many people consider things like having a meatless day. Lots of people do meatless Mondays where they just focus on plant foods through those days, or choosing a meal to just not have meat on the table. And then another important one that we want to avoid as much as possible in survivorship is alcohol. In the metabolism of alcohol, we have a carcinogen that is formed. So it has the potential to promote cancer progression. And so as a result of that, we see increased risk with increased intake of alcohol. So the current recommendations are just to avoid alcohol altogether, or if you are going to consume alcohol, that you maintain moderation if you do. Another important important part that we see often for our cancer survivors is weight gain. So where our research is most robust in the weight gain world is with breast cancer. So I'm going to speak a little bit more to that, but there are all types of cancers that we can see challenges with weight gain. And this can be due to a number of different things. We could experience weight gain as a result of the treatment itself. We tend to see weight gain being more common for those that have undergone chemotherapy. Certain medications can increase our chances of weight gain, but also things like being less physically active due to fatigue or other complications and side effects of treatment, such as nausea or vomiting. It's less likely we're going to be as physically active if we're experiencing some of those things. So specific to the breast cancer community, we tend to see that weight gain is more common than weight loss, especially after treatment. That significant weight gain can occur in a lot of this population, and most of it is gained in that first year. And the problem with that too is that this weight often persists. It's difficult to lose. And what we know with weight gain is that weight gain confers risk. So like I mentioned before, we have this linear relationship with chronic disease and BMI. Well, we see the same thing when it comes to cancer recurrence or cancer development in general, is that the higher the BMI, the more weight gain that is there, the more likely there is to be recurrence or poor outcomes. And so we want to try to avoid this weight gain as much as possible and maintain a healthy weight. For many individuals, though, many Americans, we're coming into treatment with excess weight to begin with. So part of what we want to try to move towards as a strategy for thriving in survivorship is thinking about how can we maintain a healthier BMI. And we're looking at a BMI that's below 25 and as being that more healthy body weight. And so we want to try to maintain that, because not only do we see difference for progression and recurrence of cancer, but we also see it for other chronic health conditions. So things like cardiovascular disease, which is very common in cancer survivors, as well as hypertension or diabetes. These conditions are also greatly impacted by maintaining a healthy weight. So some strategies for thinking about weight loss, if you are someone who has gained weight over the course of treatment, is first and foremost, thinking less about the scale. Ultimately, we want to help sustain a healthy weight. One of the ways that we can do that, though, is through a variety of nutrient-dense foods, like we've already been talking about. So the more that we can get those nutrient-rich foods into your diet, oftentimes that alone will result in slowly moving towards a healthier weight on the scale, because we're getting foods that have lots of nutrients but not a lot of calories. So they're filling, they help us be satisfied, but they don't cost as much to our caloric piggy bank. If you are looking at calorie reduction, thinking about something reasonable. There's nothing drastic that we want to do to try to have weight loss. We don't see benefit with that. And oftentimes when we take drastic measures, we end up with having adverse side effects. So reasonable calorie reduction could look like something at 300 to 500 calorie difference in your daily intake. Could start to slowly move you towards that healthier BMI. I am in favor of a combination approach. And what this means is putting in both calorie changes and modest calorie reduction alongside physical activity, because physical activity provides so many other benefits to our health beyond what calorie reduction alone would do. And then thinking about things like fiber that help us feel more full. We want to shoot for 14 grams for every 1,000 calories we consume. I like to look at the 10-to-1 rule if you're looking at nutrition labels, which is that for every 10 grams of carbohydrate, you see on that nutrition facts label at least 1 gram of fiber. That helps us to know we're going to get more fiber-rich foods. But one of the things I want to mention too is addressing other contributing factors. So as you can see from this image here, is that there's a lot more to it than just diet, right? There's so many factors behind why weight gain happens. As Krystle mentioned, reduced muscle mass is something that is common in cancer patients. And when we lose lean muscle mass, we lose our metabolic capacity. So that in and of itself can cause excess weight gain. Again, our treatments. Mental health, right? Excess stress, poor sleep quality, all of those things can make a difference as well in our ability to be able to move towards a healthier weight. So I would also encourage you to address some of these things. If stress is a big part of your environment right now, to seek out help for that. If you're having poor sleep quality, to talk with your doctor, right? To get the help that you need to address some of these other factors as well that could help move you towards that more sustained weight. I can't emphasize enough how important engaging in regular physical activity is as well when we think about that combination approach. So where we see the greatest impact on cancer survivors, and we see the most benefit is when we have not only a nutrient-dense, healthy diet, but also when physical activity is part of that picture. Physical activity in and of itself can reduce risk, but it's also really great for quality of life, for energy, for better sleep, for reduction in depression, and other mental health issues that we might be experiencing. Plus it helps aid in weight management, and I'm just scratching the tip of the iceberg of all the things that physical activity can help improve in our lives. And our current recommendations have changed recently, very recently, to the recommendation of 150 to 300 minutes of moderate intensity activity or 75 to 150 minutes of vigorous intensity activity. So what we mean by intensity is, you can think about it like, if you are doing something that is low intensity, you could sing a song while you were doing it. Whereas as we move to something that's more moderate level intensity, we would be seeing where we could talk and have a conversation with someone, but it would be difficult for us to try to sing a song. So that could be something like going for a more brisk walk. It could also be mowing the lawn or going on a light bike ride. Whereas when we're in vigorous physical activity, it is going to be difficult to carry on a conversation with someone. So this would be something like jogging or hiking or swimming or playing sports. And so incorporating some of these activities into your life can help to have those really great benefits that we see in our cancer survivors. Also, one thing that I can't emphasize enough is when you're engaging in physical activity, start slow and go as tolerated. Depending on where you are in survivorship, you may still be recovering from surgery or still gaining strength back after treatment. So it's not about going from 0 to 100. If you currently have been inactive, even doing as much as 10-minute intervals at a time, we see benefit. So however you can incorporate more physical activity and then build up to that 150 to 300 minutes, right? You don't have to get there tomorrow, but it's just trying to incorporate where you can. And then also trying to shift sedentary behavior. We sit so much or we have this tendency to TV surf or computer surf. And so moving away from that more too, from those behaviors, and even just standing more or walking around the house a little bit more can also make a contribution to this physical activity that's needed. I also wanted to talk about just a few of the myths that we see often in survivorship, or that survivors ask about a lot, and hopefully help dispel some of those. So one of the myths that is often asked about is if sugar feeds cancer. And so just to talk a little bit more about this is that all of our body cells, including cancer cells, use sugar in the form of glucose for fuel. So any carbohydrates that we eat, our vegetables, our fruits, our whole grains, dairy, a candy bar, right? Any carbohydrates that we have, they are going to be digested and broken down into glucose. And all of our body cells will use those for fuel. So avoiding sugar completely is not going to slow cancer growth. But what can happen, and what we want to think about more, is we want these really high quality carbohydrate foods, right? We want those phytonutrient, vitamin and mineral rich foods in our life, like our vegetables, fruits, and our whole grains. Where we want to be more conservative is with our foods that are high in our added sugars, because what we do see from those is they contribute to excess calories for us, which can lead to weight gain, which can exacerbate chronic health conditions for us, including our cancer risk. So the goal would be to, instead of thinking about limiting all of our carbohydrates, to instead focus on that overall healthy diet pattern, and then limiting things that have a lot of added sugar. So instead aiming for those nutrient dense foods that have low calories but lots of nutrition, and limiting our energy dense foods, which are ones that have lots of calories, like that candy bar, but they're not going to give us any real health benefits. One thing to look at if you were looking at a nutrition facts panel that can help you to know the added sugars in your foods are this box here, where we have our total carbohydrate, but then it also lists for us total added sugars. And our goal is that in general, we want to be at less than 25 grams or 10% of our calories from our added sugars. So this can be a nice snapshot if you're looking at labels to get an indication of where you might be in added sugar intake. Another myth that I wanted to address is soy and cancer. So there had been some concern about soy kind of early on in research that it could mimic estrogen. So soy contains isoflavones that are phytoestrogens, meaning that they're plant estrogens. And in animal studies, there was a indication that soy might be harmful for those that had hormone receptor positive cancers, that it could mimic the effects of estrogen and promote cancer growth. And what we have learned since then is animals process soy differently than humans do. And the dosages that were given to animals were not, would not mimic what we would eat in reality. So physiological dose was different than what the average person would consume in soy. And so what we see in the literature is that soy and these phytoestrogens have a very weak or no impact or even an anti-estrogen effect. So in our human studies and our population studies, we do not see across the board consistently, we don't see that soy has an impact on cancer progression or promotion. So soy foods are safe for all. And I wanted to talk a little bit more about our hormone sensitive cancers specifically, that we have significant research in our breast cancer survivors and prostate cancer survivors that we don't see increased risk at moderate amounts of intake of soy. We also see that there are not harmful interactions that occur with anti-estrogen medications. So if you're taking aromatase inhibitors or other anti-estrogen prescriptions, it is safe to do so and consume soy. So moderate amounts of soy does not increase the survivor's risk, but one thing that I will mention here too is avoiding some of our soy protein isolates or extracts or high concentrated soy products. One of the main reasons for that is that just because soy is in something doesn't mean that it's now a health food. So there are a lot of products out there that contain soy, but they don't have a lot of other nutritional values. So some of the bars that contain soy or some of our protein powders, and they're missing fiber and some of the other nutrients that we get from our whole plant food soy. So best to stick with our whole food sources. And so many ask, what is a moderate amount of soy? So it's 1 to 2 standard servings. I can't see myself, so hopefully you guys can see me, but just to give you an idea, when we're talking about tofu, we're looking at like a 3-ounce portion. If we're looking at something like soy milk, moderate consumption would be like a cup of soy milk. If we were looking at our edamame, we're looking at like a 1/4 cup to 1/3 a cup of our edamame. And then if we're doing soy nuts, we're looking at 1.5 tablespoons. So it doesn't mean you have to pound the soy. But also if soy is not a part of your life and it's not something you enjoy, there's certainly no need to incorporate soy. But there are some benefits to it from a protein perspective and again, those phytonutrients that we've talked about before. I think I may be running out of time. And so I may just stop here. Angela, do we have time for me to go through a couple more things?
Yes, let's have you do a couple of more things. Yes.
Okay. So lastly, I just wanted to talk about the ketogenic diet. This is another, diet that we hear a lot about in the cancer world. And what's happening with the ketogenic diet? So the goal here is that we're trying to achieve something called ketosis. So when we restrict carbohydrates significantly, our liver will make ketones from fat in order to provide nutrition that we need that we're not getting from carbohydrates, because our body cells live off glucose, right? And so the thought behind the ketogenic diet is if we highly restrict carbohydrates and instead opt for a high fat diet, that we can essentially starve cancer cells. And there were some preliminary findings in animal studies that looked like this could be very promising. But we have just not seen that translate into human population studies with respect to cancer survivors. We don't have the research there to really be able to speak to this within the cancer community. And this diet is very difficult to follow. So it's up to 90% fat is the traditional ketogenic diet, with very little protein and carbohydrates. When we think about our cancer prevention dietary recommendations, what have I been talking about since the very beginning? It's having all these plant foods, and we want these phytonutrients that are in our plant foods. And if we're consuming a really high fat diet and we're restricting these carbohydrates so significantly, we're missing all those beneficial nutrients that we see from our plant foods. In addition, when individuals follow the ketogenic diet, one of the things that is reported over and over again in a high percentage of individuals that follow this diet are side effects. Things like hunger, fatigue, nausea, vomiting, GI discomfort, to name a few. There's so many adverse effects that we can see. And so in our cancer community, when we have individuals who are already struggling with things like nausea or vomiting or fatigue, we don't want to add to that by the diet that you're following. A little bit more about this is that in the studies that we do have within the cancer world, we see for individuals who are participating in the ketogenic diet that there's low adherence. So there are many dropouts that happen in studies with the ketogenic diet. So again, it just speaks to the difficulty that there is in following this plan, and how those side effects could really be making a difference in someone's ability to carry through with this type of diet. Again, our evidence within the cancer community is very limited at this point in time, and many of the studies have poor quality design. So the ketogenic diet is delivered in all different kinds of ways across studies that have looked at the ketogenic diet. Most of the studies have been done in advanced cancers and limited cancer types. So it's, again, difficult to how we translate this into the cancer community. And then those side effects are for real. We see it a lot reported in the studies that have been done. So at this point, we don't have enough research to really see that there will be a benefit for cancer outcomes. And again, that's where I would just take us back to talking to and seeking out a registered dietitian who can give you a more personalized plan. If this is something, you know, that you're thinking about, that we can really talk more about those components to what a healthy pattern of eating looks like. And that brings us back here. So what we have already been talking about, just to reiterate, where do we see the evidence? We see the evidence with a healthy eating pattern. So getting away from that idea of magic diets and instead thinking about more plants, 5 servings of fruits and vegetables a day, adding more fiber, putting in that physical activity, having variety and color so we get all those nutrients that really support our health. And that's where we see a reduction in cancer risk and risk of recurrence, is when there's this harmony. And on top of that, though, we see the reduction in other chronic health conditions as well. It is more easy to maintain a healthy weight, and we get stronger immune support, better energy, and an overall better quality of life. So that healthy eating pattern is really where it's at, rather than those individual food components. And that is all I have.
Thank you so much. All right,
for the
thank you
extra
so much,
time.
Lindsey. All right, so what we're going to do now, there have been several excellent questions that I feel are very specific and complex to each individual, and that's where I would ask you guys to reach out to the speakers directly. I will be sending an email to everybody who has attended today with their contact information, along with the video of this seminar, along with the information that we're going to get in this very last question, which I think is important for everybody, and that is, what are the best internet resources or resources for people to look at that are specific to evidence-based nutrition for the cancer population? Where are some good places for people to go to get this information? And I'll leave this for both Lindsey and for Krystle.
Yeah. I am a very big fan of AICR, the American Institute of Cancer Research. AICR.org has incredible resources available to give you more helpful tools and really pulls in evidence. I also, the American Cancer Society has excellent resources as well. Krystle, I don't know if there are some specific ones you want to speak to as well.
Yeah, definitely second both of those. The Cancer Support Community is also a great nonprofit organization that has even some more specific resources for specific cancers too, and some guidebooks available. And all of the resources we recommended all have free guidebooks, handbooks, and other resources.
All right, perfect. Well, thank you guys for attending. Please join us for future seminars. And again, we are here as your resource if you have any questions that we weren't able to cover today. Thank you guys, and take care.
Thank you so much.
Thank you.